We know that the inflammatory disease, arthritis, is a big burden in the world, and most of the patients over the age of 60 suffer because of either because of osteoarthritis or because of chronic inflammatory disorders. We all know that articular cartilage is once for lifetime, and you cannot reproduce it. Until today, we are not able to reproduce an articular cartilage, which is as natural as it is in our body today. Because it is a very complex structure. It's nutrition. It doesn't have a blood supply. It doesn't have nerve supply. It gets its movement by nourishment from the synovial fluid, and also you need a lot of muscles acting so that it gets nourishment from the imbibition. So there are so many things yet to be innovated, and one of the things is an articular cartilage. And we see this day to day as an orthopedic surgeon, and my orthopedic surgeon colleagues agree that when you look at an arthroscope, this is what you find when an articular cartilage degenerates. And you also see it when you open a joint for a total joint replacement, and the articular cartilage totally degenerates. And this is how an X-ray appears when you get a cartilage destruction. And finally, the patient lands up in a total joint replacement where you replace an articular cartilage with a metal and a poly in between. And that is not lifelong. And it has got its own drawbacks. It wears off in 10 to 15 years of time. So what's the answer? So if you cannot reproduce an articular cartilage, and if you can prevent the destruction of an articular cartilage or postpone the destruction of an articular cartilage for a period of time, that's a boon to the humanity as far as articular cartilage is concerned. We know that the killer disease is rheumatoid arthritis as far as articular cartilage is concerned. It's a systemic disorder. We all know that there is inflammatory polyarthritis. We don't know the etiology well even now. It not only affects the bone and joints, it also affects the other parts, the skin, eyes, lungs, and blood vessels. And patient dies of rheumatoid arthritis not because of his peripheral problems, because of the effect on the cardiovascular system. And that's how the patient dies in a chronic inflammatory disease. What we know today as far as chronic inflammatory disease etiology or pathophysiology is concerned is that there is an activation of macrophages, mainly by the antigen presenting cells, either T cells or B cells. So these activate the macrophages, and the macrophages release TNF alpha on interleukin 1. And this TNF alpha and interleukin 1 is the one which produces synovitis. And this produces synovitis. There is release of collagenase which destroys the articular cartilage. And this is a simple mechanism where there is rheumatoid arthritis destroys the articular cartilage. But the disease is not so simple. It's not only the role of macrophages. You have affection of fibroblasts, chondrocytes, wrinkles, all these get affected. There is direct affection of bone in rheumatoid arthritis, producing destruction, and all these produce arthritis. The pathophysiology today, as far as osteoarthritis is concerned, is also almost same. They have found out increased level of TNF alpha and interleukin in the synovial fluid. So the end pathway remains the same, whether it is a rheumatoid arthritis or an osteoarthritis. The triggering mechanism may be different in two diseases. So what finally happens is the release of inflammatory cytokines, which is actually regulated by nuclear factor kappa B, exactly what Dr. Manjunath told. That's what occurs in heart, exactly occurs inside the knee or inside any synovial joint when you have osteoarthritis or rheumatoid arthritis. And this is what is triggering off and on of inflammation. That's what happens in rheumatoid arthritis. You get inflammation on and inflammation off. And this is created by an intracellular substance called nuclear factor kappa. And this is the same problem in rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, psoriasis, or any juvenile arthritis. So what happens? In the intracellular, this is exactly the same thing what Manjunath has told. You have NF-kappa B, and this is actually inhibited by inhibitor kappa B, which is very closely sitting with this. What happens when there is inflammatory stimuli, his inhibitory kappa B is destroyed. And when this gets destroyed, NF-κB gets activated, enters inside the nucleus, and then changes the genome and encodes an inflammatory response which releases TNF-alpha and interleukins, which come into the synovium, destroy the synovium, produce MAX, which is commonly described in mortality, and the chondrocyte gets destroyed, and the bone, the osteoclastic activity increases in bone, and bone erosion occurs, and finally get destruction of the joint. You have current options like non-steroidal anti-inflammatory drugs. We know the side effects of all these non-steroidal anti-inflammatory drugs. You have the side effects of steroids. You have, for chronic inflammatory disease, DMARDs, they have their own limitations. They have resistance developing on their continuous usage. Today, biologics have come. Biologics, again, most of them are injectable, they are expensive, they have their own problems at the injection site, irritation. So what's an innovative option for management of arthritis? What is this? Whether you call curcumin or curcumin, whatever way you pronounce it. Basically, it is health. What's the difference between this and curcumin? It's the extract. And if you actually look at the literature, there are more than 1,000 papers which has been published in curcumin. And a few of my friends I have in University of Chicago who are actually doing a lot of research in curcumin. There is a lot of plethora of affection of this particular substance. It is used in Alzheimer's as a chemotherapy, anti-cancer agent, anti-arthritic, and Manipal has research an anti-inflammatory agent in cardiac patients. For cataract, for gallstones, as an anti-oxidant. So many properties are there for this particular drug. That is because it has 4 basic characteristics. It's an anti-inflammatory, it's an antioxidant, it's an anti-proliferative, and it is anti-angiogenic. If you take all these 4 characters of curcumin, it can affect so many or solve so many diseases. And that is the beauty of this particular drug. Basically, for us, what we need is control of inflammation. And that is what it does. It controls the inflammation exactly by controlling the IKB, that is IKB kinase, blocks it. And because of this, NF-κB becomes inactive. It doesn't enter the nucleus and doesn't produce things. What about the evidence? Today we have some evidence as far as rheumatoid arthritis and osteoarthritis is concerned, where curcumin is used alone and along with the diclofenac sodium, which showed some improvement in 52% reduction in CRP level and some improvement clinically as far as pain and inflammation is concerned. 18 patients with rheumatoid arthritis were treated with curcumin for 2 weeks. There is definitive decrease in joint swelling and morning stiffness. What about osteoarthritis? A paper from Belgium shows 820 osteoarthritic patients are treated with the curcumin drug. Their usage of NSAID decreased by 50% and usage of analgesics. When they compared this with ibuprofen, the pain relief was similar in both the groups, but there was no side effects of ibuprofen when you use curcumin. They have also used it as a monotherapy in osteoarthritis, again decreasing the chances of NSAID side effects. So again, compared with diclofenac, showed better results and does not have complications. We call it like a golden triangle. What research we do, we have to combine the modern technology and modern knowledge with our traditional knowledge. That is what is curcumin is. Curcumin is our traditional knowledge. We combine it with the modern knowledge and use a modern technology to make it a drug. So, what is the place today? It is not a FDA approved drug, although it is a safe under the safe drug list. But you can use curcumin as an additive for when you use certain other drugs for an osteoarthritis, or when you use an anti-rheumatic drug add curcumin as even additional drug, as a nutrition supplement, so that it will help your patient. So that's the stage today, because it is under GRAS, generally recognized as safe category by USFDA, not approved as a drug, because since the trials are still going on. Then what's the problem? So I eat curcumin every day, but it is very difficult to get that blood level of curcumin by ingesting even 4 to 6 grams of curcumin per day. What I am told as to get an anti-inflammatory reaction. So it is not that easily absorbed by our gastrointestinal tract. The best usage of it was done to treat a colonic cancer. Because it doesn't get absorbed, gets excreted. It is used for a colonic cancer and it has given good results in the West. So today our aim is to make it absorb and maintain the level in the blood so that it acts as an anti-inflammatory agent. And we are still in the stage of infancy in this. So what is the best solution? Now is to make it with a self-micro-emulsifying drug delivery system, so that, or what is commonly referred to as nanotechnology, where it is put inside the tablet, goes inside, and then diverts these curcumin molecules inside the blood to achieve the blood level. And this is the early results of this, which shows that they reach the particular plasma level when it is bioenhanced curcumin is used. So this is a summary of what I have told. It's still a stage of infancy. The day will come, the day has not yet come that this is the drug for treatment. Maybe today's available tablets can be used as an additional drug, as a nutritional supplement, along with your other medication. It can be safely used in patients who have got intolerant for NSAID, compromised renal function, compromised hepatic function. But be careful when you use it, especially in patients who are already taking blood thinners, because by its own action, it is a blood thinner. So, it's an old spice with a new target. And let us go back to our roots. That is what curcumin is. Let us make life painful.